With pregnancy-related complications rising across the US, more women are in need of specialised care, especially in rural areas where there are higher rates of obesity and diabetes. Tennessee is facing the nation's highest infant mortality rates, with 2/3 of the patients in the state's counties having no prenatal care. Well, providing health care to women throughout their pregnancy in rural areas is Erlanger Health System, working in partnership with Regional Obstetrical Consultants. Let's see how one hospital and clinic in Chattanooga is providing care both remotely through telemedicine and on-site with its state-of-the-art facilities.
Any questions for me today as you're getting ready next week to have a baby?
Sometimes Dr. David Adair sees his pregnant patients in person at Regional Obstetrical Consultants in Chattanooga.
Dr. Nelson's been seeing you, and he gave me a lowdown kind of the baby's been moving good.
And sometimes he counts on technology to consult with mothers who live in Tennessee's rural areas. For many of them, prenatal care can seem out of reach, with the state's 1,000 OBGYNs clustered mainly in the 5 largest cities.
Of the 95 counties, 2/3 do not have access to a women's health care professional.
We see a lot of lack of resources, education, poor diet, nutrition, and chronic morbidities like diabetes, hypertension, obesity, which are the backbone of a lot of the chronic conditions that we see.
Fewer healthcare facilities in rural areas, along with unhealthy lifestyle factors, can result in high-risk pregnancies. Dr. Adair helped develop a medical device to address one of the most critical of those conditions.
Postpartum hemorrhage is anywhere from number 2 to number 3 cause of death in maternal mortality. What's unique about it is it is the number 1 cause of death that is largely preventable and treatable. So the device is a dual balloon, rapid fill, intrauterine balloon tamponade that does the inside of the uterus and the vagina. It's 98% efficacious, publication in the American Journal of Obstetrics and Gynecology.
When a face-to-face visit isn't possible, telemedicine becomes a vital tool to connect his high-risk patients with specialist care at Erlanger Health System.
And geographically, we have some very difficult areas to access, where women may have to drive an hour and a half, 2 hours, just to get some routine care. So by bringing connective health, we're bringing high-tech, high-touch in your home.
The program is called Solutions to Obstetrics in Rural Communities, or STORC. STORC connects patients in a 60,000-mile radius to the region's only Level 4 neonatal intensive care unit at Erlanger, along with a designated OB emergency room.
We see the whole gamut, ranging from issues with the fetuses themselves, so congenital anomalies, to maternal conditions such as preeclampsia, diabetes, autoimmune diseases, heart diseases. We run the full service of medical issues for moms and babies.
It's imperative that they deliver in the right place, and the entire project for the state of Tennessee, as many other states, is regionalization and delivering in the proper place for that mom and baby.
Another way specialists anticipate needs for mothers and babies: monthly fetal board meetings to keep tabs on upcoming high-risk deliveries.
We'll actually forecast when the baby will be born and then how long that baby will be here based on estimated gestational weight and age of the baby. That way we can ensure we've got the proper amount of services, the right technology in place to take care of that child from the second that child's born all the way through discharge.
So by bringing all these subspecialists together, we can make everybody aware of what these babies are going to need, and we can develop a plan of care together to better service these babies when they're born.
Since launching nearly a decade ago, STORC's Connective Health program has reached nearly 40,000 patients and has grown to 15 sites in Tennessee, Georgia, North Carolina, and Alabama.
I think from a nurse practitioner standpoint, it gives that rapport and that personal touch that they would not receive if they didn't have a healthcare provider in that county.
Sometimes the most simple thing is a hand. Now, I can't give you my hand with Connective Health, but I have a hand on the other side,
Each year, Erlanger delivers 70% of the area's babies. As part of the region's only academic obstetrics and gynecology program, their physicians not only practice, but also teach the very latest in maternity care, ensuring the care they provide both locally and regionally is up to the highest standards. In Chattanooga, Tennessee, I'm Stephanie Aldrich.